what I would like to discuss now is anesthesia monitoring and the use of an anesthesia chart. Let me start first by discussing the vital signs that should be monitored every 5 minutes and those that are normal of a patient that is under anesthesia. The heart rate for a canine and a feline generally runs between, for a canine generally runs between 60 to 150 beats per minute, and for a feline between 120 and 180 beats per minute. Alpha-2 agonists and opioids, such as morphine, will cause a decrease in heart rate, and atropine, which is an anticholinergic, will cause an increase in heart rate. So it's necessary to watch those areas. The heart rhythm generally in a canine varies. In a feline, it should be a normal sinus rhythm. Mucous membranes and CRTs membranes should be pink. Things to look for there are cyanosis, which is bluing of the gums caused by lack of oxygen saturation in the blood, and anemia, which is pale mucous membranes caused by hypotension and vasodilation. Respiratory rate should be between 8 and 20 breaths per minute, and the respiratory rhythm is generally irregular, and it can be exhibited as thoracolumbar breathing or abdominal breathing, and so that's generally where you will see the breathing occur. Pulse and blood pressure. The pulse is relatively strong for the most part, and the blood pressure has to be watched closely as hypotension begins to occur. All of these areas need to be monitored every 5 minutes in a physical status 1 and 2 patient, and documented physical status 3 through 5, and those patients that have been under anesthesia for 45 or more minutes should be monitored consistently to assure safety of the patient. Any changes or nearing the lower limits or upper limits of any of those vitals should be immediately brought to the attention of the veterinarian in charge. Also, all these vital signs should be monitored manually to assure accuracy of the monitoring equipment. Now I'll go ahead and discuss the various stages of anesthesia. Stage 1, generally the patient loses consciousness. They may seem to be fearful, disoriented, excited. They may possibly defecate, urinate, and pant. The respiratory rate and heart rhythm at this point is usually irregular. Stage 2 anesthesia, considered the excitatory stage. The patient has a pronounced muscle tone. The reflexes are exaggerated. The pupils become dilated. The heart rate and respiratory rate increase, and this is a hazardous stage, and elevated precautionary measures should be taken to assure safety of the patient and the handler. Stage 3 anesthesia has 4 different planes to it, 4 different stages to look for. And this usually is moving the patient from a light to a medium depth of anesthesia. The first plane is at the point when intubation occurs. The involuntary movement ceases. The heart rate and respiratory rate become irregular again, and the swallowing reflex is lost, and this is when intubation occurs. Stage 3, plane 2, is considered the surgical plane. The eyeball moves from a central position to a medial position, and the third eyelid is prolapsed. The heart rate and respiratory rate become irregular once again, and at times nystagmus can be observed. That's the involuntary movement of the eyeball back and forth. Stage 3 is deep anesthesia. The heart rate and respiratory rate become decreased, and the CRT is also decreased at this point, and this is a deep stage of anesthesia. Stage 4 anesthesia is overdose, and death can occur in the animal. During all of this time, of course, reflexes can be checked. One of the reflexes is the ear flick reflex, which can be elicited by tickling the ear, and it causes the ear to twitch. Another one is the palpebral reflex, tapping on the medial or the lateral canthus of the eye, elicits a blink, and generally that's in light anesthesia to medium. Jaw tone is observed in light anesthesia, should not be observed in medium anesthesia, and that's generally when intubation will occur. Being able to open and close the jaw. The swallowing reflex occurs in light anesthesia. It's lost going into medium, and that's when, again, the intubation occurs. Corneal reflex, by dropping a drop of saline on the eyeball, not touching the eyeball, but just dropping the saline on it, will elicit a contraction of the eye and possibly a blink in light to medium anesthesia. The pedal reflex, by pinching a digit on the foot, will cause the foot to withdraw, the leg to withdraw the foot, and that is usually in the light stages of anesthesia. The eye position is usually in a central to medial position. As deeper anesthesia occurs, it can remain in a central position and should be watched closely. The respiratory pattern generally elevates and decreases with various depths of anesthesia. The various pieces of equipment that can be used to monitor various vitals. We have an esophageal stethoscope here, which is put into the esophagus of the animal. This can be used to confirm the readings of the ECG and the pulse oximeter on the heart rate. You can actually hear the heart beating through it. The pulse oximeter is clipped to the tongue or the ear of the animal. Generally, you get a better and more accurate reading with the tongue. This gives you your heart rate and your SpO2 percentage, which is your blood oxygen saturation. The Doppler is used to monitor the blood pressure. It has a very sensitive crystal that is located in the tip of it here, that is placed on the pedal artery. That's used with the gel and then a vet wrap to secure it in place on the animal, and then the cuff which goes around the leg just above the placement of the crystal. Thermometer, of course, to monitor the temperature of the patient to avoid hyper or hypothermia, and the stethoscope to double check, again, the heart rate, and you can also listen for respiratory sounds, any crackling or wheezing, stridor, or things such as that. One other piece of equipment that I don't have here with me is the ECG. It's a pretty big piece of equipment that we have in surgery. That, of course, is hooked up using the clips on the front and forelimbs and hind limbs of the patient to monitor heart rate, rhythm, and other vitals that are critical to anesthesia monitoring. I think I've covered just about everything here. Again, it is critical to monitor these vital signs every 5 minutes in P1 and P2 patients, and consistently for P3 through 5 in patients that have been under anesthesia for 45 or more minutes. So that covers anesthesia monitoring and the use of an anesthesia chart.